and in succession to the videos what I had been taking up nowadays on the pregnancy related topics. So in the professional exams, it is now it becomes very important where it comes to write in the form of a short note on the premature rupture of membranes. So this premature rupture of membranes, that is also called as the PROM, and there is something called as preterm premature rupture of membranes. So there are two things. One is premature rupture of membranes and the other is the preterm premature rupture of membranes. So in this video, I'll be mainly focusing on as to what is this premature rupture of membranes and how to diagnose it, and what is the treatment modality, what is associated with the premature rupture of membranes. So actually during the entire course of pregnancy, the baby, the newborn, the fetus, what is there, it is present in a sac, what is called as the amniotic sac or the placenta. So actually the baby, the fetus, what is lying is, it is into a sac-like structure which is called as the placenta, and within this placenta, through it is constantly being, the fetus is continuously bathed in a liquid what is called as the amniotic fluid. So this is the amniotic fluid in which the baby is constantly bathed in, and during the entire course of pregnancy, the baby is going to drink the amniotic fluid. Through it is going to receive the nourishment and the nutrients of it. So in the condition of premature rupture of membranes, what do we find is that there is an abrupt break into this amniotic, that is amniotic chamber or this placenta, the membranes that rupture. So the membrane, that is it is going to rupture, and there is leakage of the amniotic fluid. So once the amniotic fluid is leaking, so that is the condition what is called as the premature rupture of membranes. So it is mostly seen that during the entire course of pregnancy, what it is seen is that this premature rupture, if it is occurring at the gestational age of more than 37 weeks, so more than between the period of 37 to 40 weeks of pregnancy, this is considered as a full-term pregnancy. So if the water breakage is there or the rupture of membranes is there at the end of 37 weeks or between the time span of 37 to 40 weeks, this is considered quite normal. And what do we find is that 90% of the cases, once the membrane is breaking after the period of 37 or between 37 to 40 weeks, most of the women, they are going to experience the labor pain from 12 to 24 hours. So within 12 to 24 hours, they are going to experience the labor pains. So if the premature rupture of membranes is occurring between 37 to 40 weeks of gestation, 90% of the cases, there will be spontaneous labor will occur within a time span of 12 to 24 hours. Apart from this, if this doesn't happen, so your healthcare professional, your doctor is going to induce the labor pains by giving certain medications so that the labor pain may be induced, and that will cause the propulsion or the expulsion of the baby through the birth canal. So the treatment of premature rupture of membranes after the gestational age at 37 to 40 weeks is that if the spontaneous labor is not occurring, in such a situation, what is going to happen is the doctor is going to prescribe certain medications, and those medications are going to allow the progression of labor. Apart from this, what it is considered the treatment modality, that delivering the baby within 24 hours, usually it is the safest option. Now, if the rupture of membranes or the rupture of membranes is occurring at the gestational age of 34 to 37 weeks, so in such a situation, in such a condition, the healthcare professional is going to weigh the risk of premature birth with the risk of infection or the complication what can be associated to it. So the risk of premature birth with the risk of infection and complications what will be associated to it, the healthcare professional is going to weigh that what can happen if the risk of premature delivery is going to be more harmful. So the doctor will try to prolong the pregnancy, or if the condition that the risk of infection is too much, so that will be analyzed and the treatment will be based on it. Now, if the gestational age is between 34 to 37 weeks of gestation, the healthcare professional in certain situation, if they analyze that the baby needs to be delivered, so the delivery of the baby will be there, and the healthcare professional, they will mostly suggest the parents that they should arrange for the neonatal ICU, that is the NICU. So neonatal intensive care unit, the doctor is going to arrange for it, and when the baby is born between the gestational age of 34 to 37 weeks, so the doctor is going to carefully analyze that either if it is a premature birth, if it is a premature delivery is there, or if the pregnancy is to be letting to continue. So if the pregnancy needs to be continued at this stage, so doctor is going to carefully weigh that what complications can occur if the baby is born premature, or what all complications in the form of infections can occur if the pregnancy is letting to be continued. So these things will be analyzed by your healthcare provider, and on that basis, if a condition says that the baby needs to be born between 34 to 37 weeks of gestation, so the doctor is going to arrange for a neonatal intensive care unit, that is the NICU. So babies born between 34 to 37 weeks of gestation needs to be taken care in the NICU. Now, another very severe condition, that if the rupture of membranes is occurring less than 34 weeks. Now, this is very, very alarming. This is quite a risky thing. It is a great complication for premature birth. Why? Just because before 34 weeks of gestation, the lungs of the baby are not developed. And if such a baby is born prematurely, just because the lungs are not developed, so such a premature birth, the baby cannot survive. So in such a condition, in such a situation, what is going to happen is that if the gestational age is less than 34 weeks and the premature rupture of membranes has taken place, so the complications for a premature birth are higher, and in such a condition, the patient needs to be hospitalized. So whatever the expecting mother is there, if she is complaining that the gestational age is less than 34 weeks and the premature rupture of membranes has taken place, the patient needs to be immediately hospitalized. The patient will be admitted to the hospital, and the doctors are going to constantly monitor the fetal heart rate and the movements of the fetus. So that these parameters also needs to be assessed, whether the heart rate of the baby is there, whether the movements of the baby is there or not, and they will look for any signs of any kind of a fetal distress. So if fetal distress is there, so these things needs to be very closely monitored, and the patient, the expecting mother, is advised complete bed rest. And since the gestational age is less than 34 weeks, so in such a condition, the delivery of the baby is, most of the times, it is next to impossible that the babies should be delivered. So in such a situation, the doctors are going to prolong the pregnancy, and they will take all such measures so that the pregnancy can be prolonged. So how to prolong the pregnancy? First of all, if the gestational age is less than 34 weeks, and the premature rupture of membranes has taken place, the amniotic fluid is lacking, it is leaking through the birth canal. So if the amniotic fluid is lacking, the pregnancy needs to be prolonged. And first, the treatment method is that because less than 34 weeks is there, so the lungs of the baby is not developed, so such expecting mothers are given the corticosteroids, and particularly the corticosteroid, what is there, it is the dexamethasone, to help to develop the fetal lungs. So fetus's lungs needs to be developed. For the development of the fetus's lungs, the corticosteroid, that is dexamethasone, is given to the expecting mother. Apart from this, if the rupture of membranes has taken place less than 34 weeks, so in such a condition, there is a possibility that certain infections may flare up in the expecting mother. So in order to prevent such infections, antibiotics are given to prevent the infection, and the pregnancy needs to be prolonged. Apart from this, there are certain drugs what are called as the tocolytics. So these tocolytics drugs are there. These medications are given to stop the labor. So gestational age is less than 34 weeks. So tocolytic drugs are administered to the expecting women so that the labor should be prevented. So medication to stop the labor is being given, and The treatment method is that in such a condition, magnesium sulfate is also given so that the development of the fetus's brain takes place. So magnesium sulfate is also given. So the overall treatment method is aimed to progress the pregnancy to at least 34 weeks. So if the premature rupture of membranes is occurring at a gestational age of less than 34 weeks, whatever the treatment modality is there, it is absolutely aiming to prolong the pregnancy, to progress it to at least 34 weeks of gestation in order for the baby to survive. All right. Now, when we look at the examination, this was all about the treatment methods. If the gestational age is 37 to 40 weeks, if the gestational age is ranging between 34 to 37 weeks, and if the gestational age is less than 34 weeks. Now, how the doctors, if the expecting mother is complaining of a watery discharge in the birth canal through the vagina, if she is complaining of, and the patient comes to the OPD. So in such a situation, what is going to happen is that the diagnosis is made through the per speculum examination. A sterile speculum is an instrument. It is taken and it is inserted into the vagina so that the wall of the vagina, just to separate the vaginal wall and to examine the cervix. So if there is leakage of the watery fluid there are certain tools through which we can analyze that the leaking amniotic fluid, it is actually the amniotic fluid or not. For that, the nitrazine paper is there, which is just a pH paper. If the color of the paper turns blue, so and that indicates that the pH is more than 6, so that indicates that it might be an amniotic fluid. And apart from this, there are certain tests which can be done, that which is also called as the Ferning. So this Fern test is there. So this amniotic fluid is taken and it is viewed under the microscope so that the fern-like appearance of the amniotic fluid is seen. So this was about the diagnosis, where the per speculum examination is there. Through microscopy we can make out, and with the help of nitrazine paper, the doctor is going to examine that whether it is actually the premature rupture of membrane, it is actually the leakage of the amniotic fluid or not. So students and viewers, this was a very short discussion where I've tried my level best to give you in simple terms as to what is the premature rupture of membranes and what are the treatment modalities at different periods of gestation, and the diagnosis of it. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. And if you like this video, give this video a thumbs up. Thank you for watching.